Okay, here it is again. Of course, now it's middle of the afternoon. Hello world. Hello YouTube. Here it is again. Subject comes up. Healthcare. Now, I've made a video once about this, so I think I'll put this right straight to the president. Not that it'll do any good, because he's hooked up and he wants to be hooked up. My idea, here it is now. This is what we need to do. Healthcare is a misdefinition of what we need. We need to separate healthcare from medical care. Medical care needs to go on its own. We need to cut them off. Alright? They've had their time. Them and their pills and their elixirs and potions and all that crap. They're nothing but legal dope pushers. Okay, that's all it's to it. You can't say anything different. You know, my wife, the doctor put her on this Paxil, right? And she took this stuff for a couple of years, and finally I got fed up. I said, man, these are your stupid pills, because you take them and you just go stupid. And I said, you got to quit taking them. And by God, being the good wife she was, she did. She quit taking them. And by the time she quit taking them, it didn't make any difference. They injured her. I mean, they wiped her out. She used to be a heck of a gal. She was into firearms. She was just as about as, she was by my side. She was just about as rough and tough as I am. And boy, but after that Paxil, that was over. It was gone. She would just sit. She'd sit, watch TV, have a couple beers. Well, that was it. So I'm like, what the hell? What is that all about? So, and I'll tell you another thing now. That all they do is they just change the name, the shape, size, and color of them pills, and put it out as something different when everyone figures out what them pills do and how dangerous they are. So we need to find a way to just get away from all of that. They don't care about us. All they want to do is sell us dope. That's all that's to it. They don't care about us. They don't give a flying fish about anything we do. They don't want to cure us. They don't want to do anything for us but get our money for these dang pills. And now they're all into Washington, I guess, lobbyists. It took me a minute to figure out lobbyists. What the heck's a lobbyist? I go, oh, they're out in the lobby when they come out of the house where all the round chair thing is. It's the house. I know what it is. I'm just playing. But they're out in the lobby and they go jawing with these people that are supposed to be running our country and say, yo, I'll give you a bunch of bucks if, you go in there and promote my pills. So now they're just as bad as any dope pusher that I've ever met. And I've met a lot of them, believe me. Okay, well, we won't go there. Anyway, yeah, let's get back on subject. I'm watching YouTube. This is what I get. I get this stuff on YouTube and then I start going off. Because I got all... I'll tell you the name later. I forgot his name. I got it. Let me see. Yakety Yak. Nope, he's not on. Let me get here. I got 10 minutes, so y'all gotta suck it up. Oh yeah, history. Anyway, this is what we need to do. We need to get these pill people out of our lives, out of our political and our leadership lives. Get them out of here. The mediticians too. It took me a minute to come up with that name, meditician. It's just medical technician. That's all they are. The medical technicians. Just like me, I was a mechanic. I was an automotive technician. And, oh, here we go. Red Dawn 63. Pretty good guy. He's just starting out. I think y'all should look him up. Anyhow, medical technicians. That's all they are. And the Paxil thing. I asked my wife, so he gives you these pills, did you ask him what they're curing? Are they curing something? Do they do something to make that stuff go away? What's going on there? I want to be cured. I don't want to be maintained. Okay? But they just don't get it. They don't care. They just want to sell you some shit, get you in your office, take their Maserati payment out of your ass, and out the door you go. So... this is what we need to do. And Mr. Obama, Mr. President, you better listen, because this is about the last chance you got with me. You didn't have one before, but I didn't, I didn't neither here nor there with you. Okay? Here's what you need to do, brother. You need to get that pharma out of your office, out of the lobby. Okay? Out of the lobby. Get them out of there. And with all them billions and trillions of dollars you got going on, I want a gym or a health center, a government health center with the treadmills and the lifty weights and all that on every street corner. Or at least what you should do is put them on every school grounds to where the adults can go in and with the time go down and be able to work out. Now if they do that at the schools, there you go. We're setting an example for our kids. Okay? Now if we're working out, they'll work out. They lose that weight and get straight up. That's what we need to do. That's where the money needs to be spent. Can you imagine the jobs in constructing these health centers, not medical centers? I'm sick of medical centers. Get these medical centers out of here. Put them on their own. You know, and if we do this, we can reduce their importance in our lives. You know, why make them a need so badly when we could just avoid them and put them in their proper place by curing diseases that we can't cure ourselves in a health center? See what I'm saying? Alrighty then. So, you know, that's the deal. I want a health center on my street corner, brother. That's all it's to it. You get a health centers, like put them on all the school grounds or in the thingies, you know, on every street corner. You got these drug stores on every corner, the Walgreens, the Save-Ons, I mean, the list goes on. And I mean, to tell you, they're on every corner. They're there more than any other. You know, with the pharmacy and all the elixirs and potions and all the crap that they put out. I want health centers. Health centers, you know, to where I can take care of my health. I can. And if I need a medical center, I'll go to it. The medical center should be, like I said, to take care of the things I can't take care of in the health realm of my life. Okay? Health centers. I know I'm saying it all 2-3 times, but you know, I'm really adamant. My wife would be alive today if she had a place to work out. I mean, she died of heart failure because there wasn't nothing to do. There was nowhere to go to do it. You can go to the park. I mean, what's there? Okay? Now let me cover another one I think I messed up and didn't go on. Look at the jobs. The construction jobs of constructing all these things, all these health centers, and the jobs to maintain them, some folks to be in there all the time to help people go in, the dietitians that can tell you, you know, don't eat that crap you ain't supposed to eat, and you're supposed to eat this crap. Sooner or later it's going to soak in. I get with the program, you know, if I get dogged enough. Say, you got to quit eating them dang Twinkies. Okay, that old dang, like old Glenn Beck. Here's an issue I want to put to you, okay? Glenn Beck gets all pissed off because he says, don't sit there and try and deny me the right to eat as many Twinkies as I want. Well, that's okay. That's fine. You know, if you have the right to those Twinkies, just because you could doesn't mean you should. Now, with great freedoms, and I don't mean, oh, great, freedoms are great. I mean great freedoms, big freedoms, responsible freedoms. With great freedoms comes great responsibility, people, okay? Just because you can eat a shitload of Twinkies don't mean you should eat a shitload of Twinkies. You should look at that Twinkie and go, I could eat all them Twinkies, you know, but I really shouldn't because I'll blow it up and I'll be looking like a Twinkie, right? So stop that. Now let's get down. If this is a war of attrition, well, we need to attrite. Eat right. Get exercise. Get out there, do something. Look at China. I mean, you see, every time you see something on China, right, you got 1,000 individuals out there in a big old field doing Tai Chi or doing some kind of exercise. That alone is going to give them the ability to whoop our ass. And we go, okay, I'm a big, stupid, fat guy. Look at me, I'm a big, stupid, fat guy. You know, you got to hand it to them. Come on, let's look at this in reality-based mindset. You know, they're out there hustling. What are you doing? Eating Twinkies. Dude, come on. Alright, that's my rant, and I'll put it on. I gotta go work out on my damn kid's car. She done messed it up, so it's up to me to fix it, I guess. So, take it to heart. Come on. Separate medical care from health care. They're two different things. Let's define this what it is. Alright. Bye. That's cool.